Imagine drinking warm gladiator blood straight from the arena to cure epileptic seizures. Imagine injecting crocodile droppings into your body as a contraceptive. Could you swallow wine sweetened with lead as your daily medicine? Welcome to the terrifying world of Roman medicine, where drugs were often more deadly than the disease itself. Step inside the Colosseum for a moment. The crowd roars as a gladiator falls, his life fading away on the sand-covered floor. But wait, the show isn't over yet. The spectators rush forward, not for souvenirs, but for something far more gruesome. The gladiator's fresh blood. The Romans believed that the blood of a brave warrior contained his courage and vitality. For epileptics, this was not just superstition. It was a prescribed treatment. Pliny the Elder, the most famous Roman naturalist, described this practice with clinical impartiality. Epileptics drank the warm blood of fallen gladiators directly from their wounds, believing that it would give them the strength of the fighter and relieve them of their seizures. The fresher, the better. The Romans believed that blood lost its power as soon as it cooled, so time was of the essence. Imagine the desperation of families dragging their epileptic relatives to the arena in the hope that the death of a gladiator would save the life of their loved ones. But blood was only the beginning. Gladiators' livers were considered even more powerful. Wealthy Romans paid large sums of money for fresh gladiator livers, which they believed contained the essence of a warrior's bravery. They ate it raw or lightly cooked, believing that cooking diminished its magical properties. The most frightening thing? This was not the preserve of backstreet charlatans. Respected doctors such as Scribonius Largus prescribed gladiator blood in their medical treatises. The practice was so widespread that entrepreneurs opened shops near the arena, selling gladiator blood and organs like street vendors. Think modern medicine is unpleasant? Roman women inserted pessaries made from crocodile dung into their bodies as a contraceptive. The logic was twisted, but it was consistent with Roman medical thinking. They believed that the acidic properties of crocodile dung created an unfavorable environment for conception. This was not an uncommon practice. Crocodile dung was imported from Egypt at a huge price, making it a luxury item. Wealthy Roman women literally inserted animal excrement into their bodies, considering it a more reliable method than other methods. But crocodile dung wasn't the only fecal substance in Roman medicine cabinets. Pigeon droppings were mixed with honey to treat baldness. Men smeared this rotten paste on their scalp and left it on for several hours. Dog excrement was prescribed for throat infections, applying it directly to the neck as a poultice. Human urine occupied an even more honorable place in Roman pharmacology. Fresh urine was considered sterile and medicinal. Romans rinsed their throats with urine to whiten their teeth and strengthen their gums. Urine aged in amphorae for several months was considered even more effective. The stronger the smell, the better the medicine. The poet Catullus mocked this practice, writing about Spanish women who cleaned their teeth with urine, but it was widespread throughout the empire. The Romans preserved the urine of young, healthy people, believing it contained life force. Imagine you are a wealthy Roman sipping your morning wine sweetened with sap, a syrup made by boiling grape juice in lead pots. You have no idea that you are consuming one of the most insidious poisons in history, thinking you are taking medicine. Lead compounds were a miracle cure for all ailments in Rome. Lead acetate, which the Romans called lid sugar because of its sweet taste, was prescribed for everything from eye infections to stomach ailments. Doctors created lead-based cosmetics for women, believing that they would preserve their beauty and youth. The irony is striking. The Romans systematically poisoned themselves in an attempt to improve their health. Water flowed through lead pipes, wine was stored in lead vessels, and medicines were kept in lead bottles. Modern analysis of Roman skeletons shows that the level of lead in their bodies was hundreds of times higher than modern standards. Roman doctors praised the versatility of lead. They created lead eye drops that caused blindness. lead contraceptives that led to infertility, and lead-based digestive aids that destroyed internal organs. The wealthy died young from lead poisoning, and their doctors prescribed even more lead to treat their mysterious symptoms. Some historians argue that lead poisoning contributed to the decline of Rome by affecting the cognitive abilities of the ruling class. Imagine generations of leaders making increasingly irrational decisions because their medicines were literally eating away at their brains. Socrates died from hemlock in Athens, but the Romans used this deadly poison as an everyday medicine. They believed that small doses of toxic substances could cure various ailments, a primitive understanding of hormesis that led to disastrous consequences. Roman doctors prescribed hemlock to relieve pain, unaware that the line between a therapeutic dose and a lethal dose was very thin. Patients consumed carefully measured amounts of this deadly plant, hoping for relief, but often found death instead. Aconite, known as wolf's bane, was another favorite poisonous medicine of the Romans. Doctors used it to treat everything from fever to arthritis. The plant contains aconitine, a compound so toxic that even touching the plant can cause poisoning. The Romans ground the roots and mixed them with wine, creating deadly cocktails that they believed were healing elixirs. Belladonna, with its beautiful purple flowers and shiny black berries, was used to dilate the pupils. Roman women believed that dilated pupils made them more attractive. They dripped belladonna juice directly into their eyes, unaware that they risked blindness and death. The plant's name literally means beautiful woman in Italian, which is a testament to this dangerous cosmetic practice. Mandrake root was perhaps the most feared and revered plant in Roman medicine. Its human-like shape convinced the Romans that it contained a soul. They believed that mandrake could cure infertility, but complex rituals were required to collect it, as touching it was said to cause madness or death. The Romans discovered mercury in Spanish mines and were fascinated by its properties as a liquid metal. They called it living silver and believed it had magical healing properties. Mercury was prescribed for skin diseases, syphilis, and even as a general tonic to increase vitality. Patients rubbed mercury directly onto their skin or consumed it in small amounts. The metal's ability to form amalgams with other metals convinced the Romans that it could cleanse the human body of impurities. They did not understand that mercury vapors affect the nervous system, causing tremors, personality changes, and ultimately, death. Roman hatmakers used mercury to treat felt, which led to widespread mercury poisoning among artisans. The expression, mad as a hatter, originated from these mercury-poisoned workers, whose unpredictable behavior was caused by exposure to toxic substances. The Romans discovered the emetic properties of antimony, its ability to induce violent vomiting, and believed that this made it an ideal medicine. They created antimony cups for wine, believing that wine contaminated with antimony cleansed the body of disease. Rich people regularly drank from these cups, believing that this would keep them healthy. Antimony causes severe gastrointestinal disorders, which the Romans interpreted as ridding the body of disease. They did not realize that they were systematically damaging their digestive tract. Antimony was also ground into powder and used as a cosmetic for the eyes. Roman women lined their eyes with antimony-based makeup, unaware that they were applying a toxic metal to one of the most sensitive areas of the body. To understand Roman medicine, you need to understand their worldview. The Romans believed in the doctrine of signatures, the idea that natural substances are similar to the parts of the body they can treat. Red substances, such as gladiator blood, were considered blood-strengthening, and walnuts, which resemble the brain, were prescribed for head injuries. They also adhered to the concept of sympathetic magic. Consuming the attributes of powerful things made a person powerful. Gladiator blood contained courage, lion hearts gave bravery, and eagle eyes improved vision. This way of thinking led to increasingly strange and dangerous treatments. Roman doctors performed surgery without understanding the theory of microbes, anatomy, or pharmacology. They relied on tradition, superstition, and trial-and-error experiments on their patients. When treatment did not help, they often prescribed stronger doses or more exotic ingredients. These horrific treatments were not evenly distributed throughout Roman society. The wealthy could afford exotic poisons such as crocodile dung and gladiator blood, while the poor had to make do with cheaper alternatives such as human urine and animal excrement. Ironically, the poor often lived longer because they could not afford the most dangerous treatments. While wealthy Romans poisoned themselves with lead-laced wine and mercury-based cosmetics, the poor drank plain water and used simple herbal remedies. Roman medicine created a twisted class system in which wealth gave access to more sophisticated methods of self-poisoning. The rich died young from expensive treatments, and their doctors, observing these deaths, concluded that they simply needed stronger medicines. Roman women faced unique medical horrors. In addition to contraceptives made from crocodile dung, they used lead-based cosmetics that caused facial paralysis and skin necrosis. They believed that beauty required suffering and were willing to risk their lives for their appearance. Pregnancy care was especially dangerous. Roman women used mixtures of mercury and lead to prevent miscarriages, unaware that these metals caused the very problems they were trying to prevent. The death rate during childbirth was extremely high, partly due to toxic prenatal care. Roman doctors had strange theories about female anatomy. They believed that the uterus could wander around the body, causing hysteria, which led to treatments that included fumigating the female genitals with burning sulfur and other toxic substances. Roman doctors were not malicious. They sincerely believed in the effectiveness of their treatments. Medical education was primitive and based on memorizing ancient texts rather than understanding human biology. Doctors were respected members of society who charged high fees for their deadly services. When patients died from treatment, doctors blamed the disease, not their medicines. They developed complex theories to explain treatment failures, which led to even more complex and dangerous treatments. The medical profession found itself in a vicious cycle in which the toxicity of treatments steadily increased. Some doctors began to question traditional treatments, but they were dismissed as radicals. The few who advocated more gentle treatments were often ignored in favor of colleagues who promised radical cures through extreme measures. The terrifying truth is that many Roman treatments persisted for centuries. Mercury remained the standard treatment for syphilis until the 20th century. Lead-based cosmetics were common in Europe until the 1800s. Some Roman poisonous medicines only disappeared when modern chemistry revealed their true dangers. Roman medicine demonstrates humanity's capacity for self-deception. When we desperately want something to work, we can convince ourselves that poison is medicine, that pain is healing, and that tradition is wisdom. Today, we look back on Roman medicine with horror, but we must remember that future generations may look back on some of our modern medical practices with equal disgust. Medical knowledge evolves, but people's desperation and willingness to try anything to be cured remain unchanged. The next time you take a simple, proven medicine, remember the Romans who drank gladiator blood and injected crocodile dung into their bodies, believing they were saving their lives. Sometimes the most frightening thing in history is not what happened to people, but what they willingly did to themselves. Roman medicine shows a civilization that mastered engineering and law, but remained in the Dark Ages in the field of medicine. Their advanced society built aqueducts and roads that lasted for millennia, while at the same time poisoning itself with treatments that would horrify modern doctors. The medical legacy of the Romans is not only ancient superstition, but also a warning about the dangers of excessive self-confidence in medicine and the human tendency to prefer complex and dangerous solutions to simple and safe ones. In their desperate quest for health and longevity, the Romans created a medical system that shortened life and increased suffering. Perhaps most disturbing of all, Many of these patients probably felt temporarily better after the toxic procedures, which confirmed their doctors' beliefs and perpetuated deadly practices for generations. The placebo effect, combined with the initial euphoric properties of lead and mercury's apparent ability to cleanse the body through vigorous purging, created a false sense of progress in medicine. Roman medicine reminds us that good intentions, public recognition, and even temporary improvements do not guarantee safe or effective treatment. The blood of gladiators may now be cold, but the lessons of Roman medicine remain relevant today.